How to get rid of tonsil stones. Tonsils can be found in the throat rear and constitute a fraction of the body's immune and lymphatic systems. The tonsil stones form as small stones in that region. While they are normally without symptoms, they could be responsible for bad breath. Normally, the tonsils catch bacteria so they do not go deeper inside someone's oral cavity. Nevertheless, the tonsils do possess small folds, where food and bacteria gather to form stone-looking and small substances which doctors refer to as tonsillotiths or tonsil stones. Asides bad breath, tonsil stones could lead to sore throat, difficulty in swallowing, inflamed, and hoarseness. Red tonsils. This article will be teaching us how we can remove tonsil stones by ourselves and when we should see the doctor. 1. Low-pressure irrigators. You can make the tonsil stones look loosened by applying a water irrigator with low pressure like water flosser. To achieve this, you can stand before a mirror that is properly lit and focus the flosser in the direction of the said tonsil stones. You should be careful when making a tonsil stone free because it could fall into the throat, resulting to coughing. This is bad for kids because they could choke. Someone can equally employ a flosser for irrigating the tonsils regularly to aid in the preventing the formation of tonsil stones. Irrigators can be bought online. 2. Non-alcoholic mouthwash. A calm non-alcoholic mouthwash within the mouth could aid in loosening tonsil stones while reducing the number of bacteria within the mouth at the same time. Having lesser number of bacteria can also play a role in preventing the formation of tonsil stones. Non-alcoholic mouthwash can be found online and in drugstores. 3. Saltwater gargle. Saltwater gargling can also be useful in loosening tonsil stones. Someone can have this prepared by adding half teaspoon of salt into 1 cup of warm water. Gargling the liquid for about 10 to 15 seconds will do. Saltwater gargles are also good for relieving sore and scratchy throat. 4. Apple cider vinegar gargle. Using apple cider vinegar that is less concentrated for gargling may aid the breaking down of materials within tonsil stones. Combine 1 tablespoon ACV with a cup of warm water before you gargle. Doing this 3 times daily could also loosen the tonsil stones with time. The risks associated with using ACV comprise tooth decay and digestive problems. 5. Cotton swabs. A couple of persons employ cotton swab for sweeping tonsil stones away from the throat rear. One could get injured with this method. Always discuss with your doctor before doing this, and don't use this method on any child. Dampen swab slightly, insert it in the direction of the throat's rear, and sweep stones away. Do not touch the throat middle portion, so it does not cause gag reflex. Since several blood vessels are around the tonsils, it's very crucial that you do only few sweeps using the cotton swab. Stop the use of swab should you experience any bleeding. 6. Toothbrush. Some other persons attempt getting rid of tonsil stones using a toothbrush rear. Just like cotton swab, you could get injured using this method. This method is bad for kids since they are likely to choke. Have the brush flushed over, using the non-bristled part to carefully loosen the tonsil from the throat rear. Brushing the teeth and tongue can drastically reduce the number of bacteria inside the mouth, thereby preventing tonsil stones in developing. How long do tonsil stones last? The tonsil stones normally dislodge themselves with time. Someone may cough up a stone in the process or even feel it dislodged prior to swallowing it. Nevertheless, if someone has got a stone that is persistent which appears to be growing bigger, it may be wise discussing with a doctor. Medical treatment. If an individual is experiencing irritating, frequent stones, a health advisor may suggest a tonsillectomy, removing the tonsils with surgery. While this surgery is totally normal for kids, adults are likely to experience notable bleeding as well as recovery times. Doctors only advise for tonsillectomy when someone is faced with excruciating pains, problematic halitosis or infection due to tonsil stones. Speak to your doctor if you need clarification on anything. When to see a doctor if you're unable to get rid of your tonsil stones after applying the home remedial methods discussed above. Never try forcing out the stone with any sharp object because that could result in bleeding. Surrounding the tonsils are several blood vessels, so do not use toothpicks, safety pins, or pens for removing tonsil stones. If you suspect tonsil stones due to certain symptoms, discuss with a doctor. If you experience pains and have bad breath even after removing the tonsil stone, try seeing a doctor as well. Nose, ear and throat doctor specialists are able to help you out with tonsil stones, though you can equally discuss with your usual doctor. People should try and get medical attention for tonsil infection symptoms like difficulty in swallowing, increased tonsils which make breathing difficult, pain which spreads to your ears, white discharge or pus from your tonsils, gravely enlarged tonsils, tonsil area bleeding, disordered breathing when sleeping. A doctor is in the best position to decide what's best for a child regarding inflamed tonsils or tonsil stones. Trying to remove tonsil stones in children can result in choking. Antibiotics as well as rest could be required as treatment for an infection that is active. Summary: although tonsil stones are normally little irritation, they could sometimes cause discomfort and result in infection. When someone is experiencing this, they are advised to speak with a doctor concerning treatment alternatives.